Hello, welcome to African Regional Intellectual Property Organization. Coronavirus, a disease that has spread throughout the world, claiming so many lives, and Zimbabwe hasn't been spared. Let's talk about it. The symptoms. The most common symptoms are a fever, a dry cough, and general body weakness. But to some people, they may also have a runny nose, a sore throat, even body aches. To some people, they may also lose their sense of taste and smell. But to some, they may never get these symptoms. That is, they will not get unwell. But they can transmit this coronavirus to others, for example, when they are talking. Hence, they need to always wear a mask in public. How does this disease spread? It spreads when one person with coronavirus is speaking, coughing, breathing out, or sneezing. In that process, they are producing some small droplets in which inside there will be the coronavirus. And when the next person breathes in those droplets, then that person will get coronavirus. Those droplets, again, they can get to surfaces and objects. And when we touch those surfaces and objects, then we touch our face. Through that process, we then get the coronavirus through our nose and the mouth and also the eyes. So how do we protect ourselves from this coronavirus? Always wearing a mask in public, maintaining a social distance of at least 1 meter away from each other. We need to also make sure that we're always washing our hands with running water and soap. Which soap? It doesn't matter, whatever soap, including the green bar, is okay. If you do not have access to the running water, then you can use a sanitizer, making sure that you cover all your surfaces of your hands and you rub them until they are dry. You also need to always make sure that you avoid touching your eyes, your nose, and your mouth with your hands. You must also be wearing masks wherever we are in public. As an organization, in making sure that we protect our clients and our employees, we shall be checking temperature frequently. And if it's above 37.8 degrees, then we will consult with the nearest health facilities. We shall come for testing. Whilst we are isolating the patient, they shall test the patient and also take care of the patient. We shall be also carrying out a rapid diagnostic test, in which if it is positive, then we will call the Minister of Health staff, which they shall come and carry out their test and do the further management. If you've been in contact with a confirmed case of coronavirus, make sure that you call the toll-free number 2019 as soon as possible for early assessment. For our retainees who are also coming from outside Zimbabwe, they are put into quarantine areas for 21 days in which they shall be checked for coronavirus on day 1, day 8, and day 21. If you have these symptoms, that is fever, difficulty in breathing and coughing, make sure that you call the toll-free number 2019 as soon as possible so that you can be assisted with testing and further management. What testing? There are two different types of testing. So there is the RDT testing and the PCR testing. The PCR, meaning the polymerase chain reaction, is the one that we are using for diagnosis. This one looks for the coronavirus itself. Then the RDT, the rapid diagnostic test, this one looks for the chemicals which are produced in our bodies, which are called antibodies. These chemicals, they are produced by our body to fight the coronavirus, and therefore the RDT checks for these chemicals. If you are RDT positive, it may mean two things. It could mean that you actually have the coronavirus, or it may mean that you have recovered from the coronavirus, but you once had it. To get the true position, we then do the PCR, which will tell us the true position, whether you have the coronavirus or not. If the RDT is negative, again, it may mean that you do not have the coronavirus or you are within the window period, because our body takes about 2 weeks to produce these chemicals, and therefore you could be within this 2 weeks window period. What happens if you are PCR positive? The next thing is the Minister of Health staff will take over in your management, depending with your symptoms. If they are just mild symptoms, which is going to be the majority of people, 80%, you isolate yourself at home and then you can recover from there. Then there's 15% which may then get difficulty in breathing issues and other emergency cases. With those people, then they can be admitted in hospital. Just 5% will be admitted in ICU. How long does it take to recover? Well, it depends. If it's just the mild symptoms, which is the case of the majority, it can just take as early as 2 weeks. But if it's a severe case, then it can take up to 8 weeks. Cure. We do not have a cure as yet, but we can treat the symptoms. For example, someone with body aches, a high temperature and coughing, we can give you paracetamol and it can get better. A lot of fluids, again, they can do wonders. Let us remember this group of people that we call the vulnerable people. People who are older than 65 years of age, those not doing well on their HIV medication. This, if you are virally suppressed, then you are not in this group. But if you're not doing well on your HIV treatment, and also those people with other chronic conditions, for example, chronic asthma, diabetes mellitus, heart problems, and hypertension, then this group of people must stay away from us. Why? Because they have a high risk of getting the severe case of coronavirus. I thank you.